No, I think this was an incredibly important study, and it really demonstrated the superiority of using anti-PD-1 over ipilimumab, and also used the combination of ipilimumab and anti-PD-1 and show that superiority over ipilimumab as well. So I think the importance and the breakthrough deals with further improvement and ongoing improvements in our treatment for patients with melanoma, and suggesting that perhaps in addition to what we had previously understood with using ipilimumab as a single treatment and for anti-CTLA-4 therapy, that anti-PD-1 therapy is in fact better, and really suggested the possibility that the anti-PD-1 in combination with ipilimumab is yet a further improvement as well. Sure, I think we've increasingly understood the requirements to activate T cells to both recognize and eradicate melanoma cells. And what was initially shown by Jim Allison and others is that using checkpoint blockade with anti-CTLA-4 or ipilimumab in fact could eradicate and cure some melanomas in preclinical models. And we took that in the clinic, and in fact we're having impressive results in patients. What is now being increasingly understood is that there are many checkpoints, so not just the anti-CTLA-4, but also the anti-PD-1, anti-PD-L1 interaction, where in fact in preclinical models one can do far better than using just single treatment, and this really suggests the translation of those observations into the clinic. So again, I think by understanding that there are many aspects of controlling the immune response, and I guess I'll use the analogy of a car. And it's like trying to so-called cut the brakes on a car and having that car go forward and hopefully go forward to eradicate the melanoma is what the goal is. So I think that's the important cautionary note, that I think while this has been a significant step forward in terms of the ability to eradicate and cause both regressions and decrease the time to progression in melanoma, the cost or the consequence is that of causing increasing side effects. I think the concerning signal is that there are side effects there that can be serious. I think the positive signal is that none of these in fact resulted in fatality, and using current algorithms, these were manageable. So I think the message to clinicians and the message to those of us caring for patients with melanoma is that in fact we do have another tool in our toolbox, so to speak. We have this combination that is apparently much higher in terms of shrinkage rates, appears to have a higher durable shrinkage rate. The cost is increased side effects, but those do appear to be manageable. And what was also, I think, an important signal from the study is that patients who in fact had these side effects and needed to have treatment stopped, in fact still went on to mediate anti-tumor responses and have benefit. So I think the positive signal is in fact we've got what appears to be another step forward in trying to help our patients with melanoma. I think the cautionary signal is there are more side effects, and one needs to be cautious and judicious in the use of this treatment. But by using appropriate algorithms to take care of those side effects, in fact one can still see benefit in patients and can see tumor eradication in a much higher percentage of patients.